My name is David Vincent. I'm a neurosurgeon from Norfolk, Virginia, and I've been in private practice for about 11 years. I first heard about LessRay from some colleagues, and they explained that Rob Isaacs had been working on some technology to allow us to have workable images while we're able to reduce radiation in a meaningful way. You bring it in the room, plug it in, and with pretty minimal training in your fluoro staff, you immediately can use it. It integrates seamlessly into your existing fluoro units. Literally, you're up and going right away. You do the same things that you would do anyway. You get localizing shots. It's just that you save them and you use the software after that helps enhance the images. From a practitioner standpoint, the team is constantly exposed to radiation, and the ability for us to drop radiation dosages upwards of 95% plus and still have a workable image, the value of that was pretty obvious. To the patients as well, these aren't insignificant doses that we're giving, and remember, they're cumulative doses that matter over a lifetime. I utilize LessRay in every case that I do now. I have largely a spine practice. There are very few cases where I don't either use it to localize or to put in instrumentation, so every single case. From a user standpoint, it's a very flat learning curve. It's very simple and easy. You look at the monitor the same way you would as if you were just using the regular fluoroscope. It allows me to have better images at any given radiation dosage. So in certain cases, not just reducing the radiation, it's the ability to actually enhance an image that would be difficult. In an instance of that would be, say, a mid-thoracic case where we're having difficulty visualizing the anatomy, or perhaps maybe even obese patients, the ability to work really hard to get those initial shots and then to use the enhancement software after that. It's better images. When you compare the standard fluoro image and the LessRay, it's a dramatic difference. It's not a usable image on the fluoro most of the time, and on LessRay, it looks just like the full dosed image. I think all of us have seen the need. It's intuitive that you would want to reduce the radiation dosage, but up to now, the image quality suffered, and so in particular with the minimally invasive cases, has a direct correlation with safety of the case. What technology like LessRay allows us to do is to achieve those radiation reduction goals that we want to achieve anyway. One of the other great features of LessRay is the alternate function, such that it allows you to flip between your uninstrumented pre-op view and the post-instrumentation view, so it just gives you a better feel of the anatomy where you've just placed the instrumentation. It allows us to flatten out the learning curve for the fluorotechs as well. And in particular, because of the viewfinder function, it allows you to see where the fluoro sees, what it sees before you obtain the shot. So we're not getting useless images just to get to the one that we care about. Radiation reduction has become not just one of the occupational health issues of our time, but it's one of the unspoken public health issues of our time. Moving forward, we are just not going to be able to justify using full dose radiation when a technology like LessRay allows us to drop the radiation dosage and still have a workable, usable image.